Hello, my name is Jesse Nunez. Let me adjust the camera a little bit. Okay. My name is Jesse Nunez, and I'm going to be doing my subcutaneous injection checkoff. To begin, I'm going to identify the best possible areas for subcutaneous injection. So it's the anterior portion or the posterior portion of the upper arm. So up here, the interior portion of the thigh, so about right here, and then medial costal to the, or below the abdomen, medial costal to the iliac crest. Okay. And so to begin, I'm going to foam into my med room. Just do that always, just in case. Okay. And then I'm going to check my prescription orders and all that. So I'm going to find my patient in the MAR. So I have Anna Pawlowski. This is my BMS paper chart. Anna Pawlowski, age 63, born 5/5/1957, and she has a penicillin allergy. So we will ensure that we do not administer any penicillin, and her reaction is that she breaks out into hives. So there is that. Okay. Next thing I'm also gonna find the order listed for subcutaneous injection. So in this case, we have vitamin B12 supplement admitted via subcutaneously, 500 micrograms, given on 5/11/2020 at 14:58 for Anna Pawlowski. Okay. So next thing I'm going to do is pull my med. So I have my medication here. So I'm going to do my 5 rights. So I have this medication of vitamin B12 to be given to Anna Pawlowski via subcutaneous. This medication is not expired. To be given on 5/11/2020, 14:58 at 14:58. So once again, this is vitamin B12 supplement to be given subcutaneously via this, or at vitamin B12, 500 micrograms of vitamin B12 supplement given subcutaneously for Anna Pawlowski at 14:58 on May 11th, 2020. Okay, so that is good. So that was my first check. I'm going to identify that I'm going to have the proper needle for this. So for this, it is less than 1 ml, so I'm choosing to use a 1 ml syringe for 0.5 mLs of medication. Since it's 500 micrograms, you can transfer it and convert that into half of an ml. In this case, I would have a 5/8 needle that is 25 gauge. Okay, so I've identified that. So now I'm going to also identify any potential medical factors that relate to this medication. So here we have vitamin B12 supplement. It's a necessary coenzyme for the metabolic process, including fat and carbohydrate metabolism. And it is necessary for protein synthesis. Recommended route is subcutaneous. Most common side effects include hypertension, erythema, rash, and red urine. And the most serious side effect is anaphylaxis. So we're going to want to keep an eye on that for sure. Most important nursing considerations is, of course, assess for signs and symptoms of a B12 deficiency. So that's paleness of skin, pallor, psychosis, neuropathy, or a red and inflamed tongue. You're also going to want to review the plasma folic acid levels, B12 levels, iron levels, hemoglobin, hematocrit, and reticulocyte labs every 3 to 6 months. And you'll basically know that it's working if these levels change and go back to a more stable state. And yeah, okay. So now I'm going to be prepared to pull this medication and prepare it. So I have my alcohol swab here. I'm going to use the used one because I'm going to save as many of these as I can. This is, of course, in the hypothetical sense. In a real life, we would actually use a brand new one. So I have my medication, and if this was a multi-use vial, I would label it with the patient's name, my first name, the initials, the date, and the time. I actually have it labeled for the most part. If anything, let me finish labeling that. So we have Anna Pawlowski, Jesse, JN. It's 5/11/2020, 14:58. So it does not expire. All right. So now we're gonna clean the top, like so, for 30 seconds, ensuring I'm going in a circular motion. And as I'm preparing it, I'm gonna compare it to the MAR once again. So I have a vitamin B12 via subcutaneous for Anna Pawlowski. The route is 500 micrograms. I'm looking at that now. The date is 5/11/2020, and the time will be at 14:58. Okay, so that has been 30 seconds. So what I will do is I'll leave that on as I prepare. So in this case, I would use a new piece of alcohol pad, but in this case, we'll say that I grabbed a new piece and I set it back on top, and if anything, I can clean it again for 30 seconds, and then hopefully that stays. Okay, so I will use a rainbow method in order to take out my syringe, but what I'm gonna do is I'm gonna draw 0.5 mLs of air. Pretty stiff. Okay, so I have 0.5 mLs of air. Now I'm going to take off the cap using a rainbow method. Okay, I'm gonna set this off to the side, hanging off the table, and I can remove this. Okay. Dispose of that. Hold it like a dart. Plunge the needle into the vial. Administer the 0.5 mLs of air. Now I can flip it over. Now I'm going to draw 0.5 mLs of the vitamin B12. I want to make sure I don't touch the inside of the plunger. There we go. So it looks like I have a bubble in there. So I'm gonna draw a little bit more than 0.5 just so I can work that bubble out. There it goes. Okay, let's get that out. And I have exactly 0.5 mLs. Let's get that. All right, I have exactly 0.5 mLs of vitamin B12. All right, so now I'm going to recap my syringe using the scoop method, not letting it touch anything else. I'm now able to recap it. And now if I wanted to, I'm going to label my syringe to ensure that it stays with my patient. So I have Anna Pawlowski, B12, 0.5 mLs, initial my name, date, and time. Okay. So now I'm going to take the label off and put it on the syringe. side. So now I'm going to gather any supplies that I'm going to need. So I'm going to have another alcohol prep pad. I'm going to have a piece of gauze just in case there is bleeding, so I can apply pressure as needed. I'll have a Band-Aid, a sharps container, well actually I don't need the label anymore, my hand sanitizer, and let's see, the MAR. I'll need my MAR open. Here's my patient. This is Anna Plabowski, and let's see if I'm missing anything. Oh, and my gloves. I will definitely need my gloves. Okay, so from this point forward, it's going to be like any other situation. So I'm going to knock on the door, foam in, say, hello, my name is Jesse Nunez. I will be doing your subcutaneous injection of your supplemental B12. Can we start off with your full name and date of birth? And she will say Anna Plabowski, born 5/5/1957. I'll compare what's on her band to the chart. I can confirm you're Anna Plabowski, born 5/5/1957, 63 years old. Do you have any allergies I need to be aware of? And she will say, I am allergic to penicillin. And I can confirm from her allergy band and the chart that it says that she's allergic to penicillin. I may ask her what happens when she takes penicillin, and she says, I break out into hives. Okay. So now I'm going to assess the scene. The scene is safe. The bed's in the lowest position. There is nothing obstructing the floor or obstructing her walkway. No clutter. The side rails are up. Brakes are locked, and the call light is in a position in which she can reach it. I will close my curtain, and I can, let's see, comfort, safety, I think we are ready to administer. So what I will do is assess her for any signs and symptoms, or do any assessments that I may need to do. So check her lab values, assess for signs and symptoms of problem breathing, hypertension, B12 deficiency, assess her skin, iron levels, things of that sort. I will educate her on the procedure. So today I'm going to be giving you your vitamin B12 supplement via the subcutaneous route. It will be 0.5 mLs of vitamin B12. Do you have any questions regarding this procedure? No? So yeah, and then I may teach her the medication in regards to things to look out for when it comes to side effects, especially most common side effects like anaphylaxis. Assess for hypertension, erythema, rash, red urine, and that sort. So now, to begin, I'm going to be doing my third and final check. So I have my medication, I have my MAR open. So what I will do is compare my medication again. So Anna Plabowski for vitamin B12 via the subcutaneous route, of 500 micrograms or 0.5 mLs of vitamin B12 to be administered on 5/11/2020 at 14:58. So we have done our last check. So what I would do in this case is I would scan the medication band, and I will scan the medication and then run it on the chart on the MAR, and document that I will be starting the administering of vitamin B12. So what I will do is I will don gloves. I can foam in again. Don gloves. And these are for our protection, so they do not need to be sterile. If I can ever get this side out. Come on. are. That's one. Let's try it this way. This is two. Okay. So once again, I'm going to be assessing for anything that may inhibit me giving a vitamin B12 supplement. Okay, so we have Anaplavowski here. I'm going to be doing it to the posterior portion of the upper arm. So what I would do in this case is I will take, or ask her if she needs anything before we begin. She does not. She's comfortable. Okay. The curtain is still closed. And now I am going to sanitize. So I take my unopened alcohol pad and I will clean it for 30 seconds in a circular motion. So we will say that that has been 30 seconds. And what you guys taught us is to leave the alcohol pad on the arm and point it to the area in which is now clear to administer the medication. You do it in a circular motion from most sanitary to least sanitary. So next up, I have my medication. So what I will do is use the rainbow method. I'll leave this on the side here. I will hold it like a dart. I'm going to pinch the skin and go in at a 90-degree angle. Goes in. I'm going to ensure I do not move the needle as much as I can. Administer. Okay, so that has been administered. I will dispose of the needle, or I put the safety cap on. So I did the scoop method, put the cap on. So now what I would do if there is bleeding, I can let go and apply pressure for as long as it may take. And then afterward I can apply a Band-Aid if anything. So we apply pressure. Okay, dispose of this in a biohazard bin. I dispose of my needle in a sharps container. So biohazard bin, put a Band-Aid on, and then I'm going to document that I completed my administering of the vitamin B12 supplement, and I'm going to ensure that my patient is now comfortable. If they need anything, here's your call light. Ensure that the scene is safe once again, bed's in the lowest position, brakes are locked. Contact us if you need us. I will open the curtain, foam out, and then dispose of all my belongings and then leave the room. So that was my vitamin or B12 subcutaneous injection checkoff, and I hope it all worked out great. Thank you.